Okay, so first, one of our members, first of all, thank you everyone for showing up today. We have a very interesting talk today with Dr. Kalia. And Dr. Kalia will be presented by our member Amina Al-Wazzan. Please, Amina, can start.
So, hello everyone. My name is Amina. I am a member of the Digital Health chapter, and today I have the great honor of presenting Dr. Junaid Kalia, a practicing neurologist and the founder of NeuroCare AI. Well, Dr. Junaid has a very extensive list of achievements, but I will start off with his education. So, Dr. Junaid graduated in Karachi University in 2006, and then he completed his residency in St. Louis in 2014. And he followed it by a 2-year fellowship in the Southampton Medical Center in Neurocritical Care. He did have a very noticeable presence while he was doing his residency and his fellowship in the St. Louis University and Southampton Medical Center, where he was noted for having great leadership qualities, and he had a great part in improving workflow, creating an effective handoff system. And he was also noted to have great enthusiasm in volunteerism. In 2021, he joined the American Board of Artificial Intelligence in Medicine, and in 2022, he joined the Harvard Medical School Executive Education. And also in 2022, he founded the NeuroCare AI just this year in January. He is also the board president of the Freelance Institute of Health Innovation and Education in Dallas, Texas. He is also a reviewer in Frontiers and also an executive board member of the Pakistani International Neuroscience Society. And he had extensive volunteer work in the Society of Vascular Interventional Neurology. So without further ado, Dr. Junaid, the stage is yours.
Wow, thank you so much for that kind introduction, Amina. I'm very grateful to be here, very grateful for your invitation, and I'm glad that you're looking at digital health as an important factor in future healthcare delivery. We're going to do this a little more important in a way that it's more interactive. So I'm going to speak for about 20, maybe 25 minutes, but then I want to open it up for questions, and then we can go from there. And the reason I'm doing it that way is because medicine is more about human interaction. It is not a software as service like YouTube that can be applied via an algorithm to millions of people. It can be, don't get me wrong, there are areas that I'm going to talk about within this talk itself, but the idea is that always it requires a little bit of more human to human interaction, requires a little bit of more concern, more empathy, more interaction specific to our human needs that can be done. So how we learn, especially in medicine and especially in care delivery, it is more about interaction. And therefore, I will allow you guys to ask as many questions as you want. So therefore, we can have an informed sort of areas. Also, most of the stuff that I'm going to talk about is on my YouTube videos, my blogs, etc. So you can deep dive into any one of them if you follow me on YouTube, etc. That all of this is definitely available, including the blogs that you can actually see these, copy paste them, etc. Reuse, all available because most of my stuff is open source anyways. So without further ado, I'm going to go ahead and start my presentation, and then we'll go from there. So everyone can hear me, and I'm assuming you guys can see my screen?
Yes, doctor.
Perfect. So today's main topic is implementing virtual care. And then one of the key things that we're going to talk about, what are the opportunities, what are the challenges, and what are the pitfalls. And one of the key terms that I use is that when I call virtual care, what is really virtual care? I call virtual care as the digital front door. The idea is that you open it up and you go into that front door, and then eventually it can become what we call a learning health system. So that's why I call this heading as the digital front door meet a learning healthcare system. Of course, I am an educator. I've been in multiple places. I'm an investor in multiple companies that end up doing artificial intelligence, also virtual care. I was vice president of We1 Health. A small change in the direction. I was actually at UT Southwestern Dallas, Texas, which is regarded as the fourth best neuroscience institute here in the United States as far as neurocritical care, and I also did a fellowship in epilepsy as well. So what are the true objectives here? One of the key things to understand about virtual care is not just truly virtual care. It is understanding the digitalization of healthcare. And then how virtual care paves the pathway. It literally makes it possible for healthcare to be digitalized. And we're going to come with some examples on there. And then eventually when your healthcare is digitized, then you can add intelligence to it. Then you are able to produce artificial intelligence, because all the data that you're capturing, which was actually lost because of analog systems, can now be digitalized. And the minute you have digitalized data, you can put intelligence in it, that is artificial intelligence. Lastly, we're going to come on challenges in implementing virtual care. This is more of an interactive session. I'm going to give you examples from both US and Pakistan, where I'm originally from, because we are helping some places in Pakistan to get virtualized and digitalized as far as that is concerned. And then one of the key things to understand, what are the true pitfalls in terms of virtual care implementation. Because if you can avoid that from the beginning, and if you can truly set it up in a way that it can basically creates a foundation of digitalization of healthcare, you can achieve a significant amount of gain, just not what we call Zoom call or Google Meet, etc. Because that's really pisses me off when people say, well, what is virtual care? What is telehealth? Telehealth is just basically you are having a Zoom call with a patient. That's not it. It is literally the key. That's what I call it. The key to open the digitalization, which is the front door, which is digitized. The minute the patient is actually virtual, the minute the patient and your interaction is digitized, you can finally achieve the true goal of digitalized healthcare. Because what is happening, right? I mean, you're not going to call the patient in and then actually have everything recorded. The minute the patient and physician interaction gets digital, boom, you can literally, the whole building, you enter the front door and the whole building can be a digitalized healthcare. What do I mean by that? Before I get into that, that's extremely important quote that I love. There are decades where nothing happens, and there are weeks where decades happen. And this is one of the key things when we unfortunately went through the COVID. And the only silver lining with the COVID-19 was the realization, the actual insight that we do need digital transformation of healthcare, and not just in the United States, but around the world. And that was extremely important, because if we don't have that digitalization, we won't be able to achieve what we want to achieve. And boom, the minute that thing happened, everyone realized, well, clearly the patient is actually online and getting virtual care. And when we realize, well, they're really happy about it, and most of them really do want it. So what happened? But then you realize that, well, you can have video feed, and if there's a facial group, you can check from artificial intelligence if there is any facial group or not on the same video. You can't do that in person. If you have tremors in your voice and you want to detect Parkinson's disease, that voice recording can be used for artificial intelligence as well. Patients are much more comfortable in their home environment, especially with psychiatry and neurology. Physicians are very important because I can see the whole background of the patient in their own house. That, for example, if they have a fall risk or not, if they're actually taking their medications or not. It is so hard to get family members, especially in neurology, right, to come in with the patient, because they know more information than the patient themselves, because patients have dementia, they're older people, they have harder times traveling. How do you get the niece, the nephew, the son to get online? And sometimes they're international. I mean, especially from Lebanon, you would know that clearly half the family members are in, somewhere around the world, including Jordan, United States, UK, Australia. I mean, I know half my family is around the world as well. So they know some information, and with digitalization, you can get there much better and take care of patients better. That was not possible. Even if the patient shows up in your doorstep physically, you can provide sometimes better care virtually, because you get better information, you get faster information, and then patients feel better because they can get to you much faster, as compared to just, parking the car for 10 minutes, as compared to logging in and finishing their visit in the 10 minutes. So there's a huge difference. So now coming back to what really do I mean by digitalization or digital transformation? There are basically three levels. One is called digitization, then there is digitalization, and then there is digital transformation. To better understand this, let's just look at the mapping technology. I don't know. I mean, I think the population over here will be much younger than I am. So there was a time we used to have paper maps. And then the first step for digitization was literally converting that paper map into PDF. That was the first time you would see a digital map. I don't know if anyone remembers, but that was where we were. We used to see literally pagination. You can page 1, page 2, page 3 on the PDF, and then you turn that map into a digital map. That was the limit that we used to do it. That was back before even MapQuest. I don't know if anyone remembers MapQuest. This is the MapQuest website. That was years ago. And this was the second step. You turn from a digital map, which was a PDF, to digitalized map, which was basically MapQuest. What fantastic experience did it bring? Point-to-point direction, especially here in US. When I first moved here, maybe back in 2006, I used to go on MapQuest, get the directions and print them out, and then go from one place to another because I did not know where to go. And then, of course, maps were very important. So this was the time we are. But where are we right now? We are in digital transformation. What's the difference? Due to the technology, you have end-to-end direction. But what it really did is extremely important. It enabled Uber. It enabled DoorDash. It enabled delivery services. It enabled food delivery, medicine delivery, any sort of delivery services. It now enables point-to-point direction for possible flying taxis. All of this was not possible until you had true digital transformation of mapping technology. Do you understand how important that is? Just to give you an idea, Google Maps makes $1 billion a year. Of 1B with $1 billion a year from their mapping technology alone. And you thought that, well, that's what it is. So there it comes in. So we are currently, from digitization is really where we are. When people say, well, we're just doing a Zoom call or a Google Meet call like we are over here with the patient. Yes, that's true. We are just doing this experience right here as we have digitized the experience. The second will be digitalization, where we are seeing some of the electronic health records coming in, the blood pressures are coming in, some temperatures are coming in, some other information is coming in, and we are going to the second step of digitalization. But that's where the money will be. The money will be when we can, when we can initiate new user flows, new use cases, new basically end-to-end experiences for both providers and patients. And this is the journey we're talking about. Digitization to digitalization to digital transformation. So literally this is a process. And in US is basically over here. Believe it or not, we are not in digital transformation. We are getting there. One of the things I'm working on as well. So digitalization is basically where US is, where we are able to see new forms of interactions. We are seeing new workflows of interactions. We are seeing more interoperability, some more data coming in. Most of where Pakistan is, I don't know where Lebanon is, but there we are stuck at the digitization. We have basically been able to do, face-to-face, in-person interactions to digital interactions. But eventually you're going to see that everywhere this is going to go on, because at the end of the day, believe it or not, the most significant device in the world is the cell phone, and the people can be reached with that and much faster, better, and easier. So what is the true difference when we talk about virtual care? Because that's a continuum, right? So virtual care continuum is basically, again, digitalization, and digital transformation, and we are only doing telemedicine, where basically a physician is getting online and taking care of the patient. And some of the times you're going to see pharmacy services also here in the United States, at least, are getting on board and making sure that the patients are taking the medication right, the compliance is okay, they're giving some information about it. Then we go to the next step, which is, the word I use is telehealth, but again, there are so many ways to say something. And what did you do? That's where we are coming in right now, is telehealth. And we are seeing what? We're basically seeing in IoT, which is health, Internet of Things. We're getting blood pressure machines that are online, where pulse oximetry is online, where, simple stuff that can be online. Then this is what we call remote physiological monitoring or remote patient monitoring. Also, we're seeing teletherapies, occupational therapy, physical therapy, speech therapy. Actually, we just finished one of the, for Saudi Arabia, they're actually trying to figure out how to make teletherapies more better in Saudi Arabia. And one of the things that I noted in that particular paper was that it is so important not to just provide care in general. It is also very important to provide care in the native language and dialect. I mean, as you know, Arabic is very different from Lebanese to Egypt to Saudi to, to places, and same thing. Just by that, just by making it available for people to communicate on their own terms, it makes a huge difference on patients' receptiveness and eventually compliance. But then we're going to come to what we call digital transformation. This is a whole digital health where we'll have data security, data governance. We can actually secure transactions through blockchain. We can change the whole experience of the patient because they can collect data and share data completely digitally. And this will also increase access and equity because there are now places. So for example, just giving you an example, we are starting a service to provide care of neurology in Pakistan eventually next year, and then have American physicians lined up. They're going to basically take those calls in Pakistan, and the idea is that when there's a higher level of service needed, some people can come, let's say, to travel to Dubai and get care, or in United States, etc. So we're going to have completely boundaryless care in the future. It's really going to take some time and legislative efforts, because then the question really becomes, well, I want to provide care in Lebanon, okay, but I don't have a medical license in Lebanon. So there are of course things that are going to need to be done from legislative purposes, etc. But you're going to eventually see those experiences completely blossoming moving forward. And of course, compute power is getting better and better. We are seeing cloud computing, edge computing. As a matter of fact, one of the things that we are working on is detecting cerebral hemorrhage, bleed in the brain through AI and ML. And one of the boxes we are developing is edge AI. So not only you don't even have to send the data to your cloud, that literally $120 device can detect bleed directly on the device itself. And of course, AI is huge, not in terms of computer vision, natural language processing, and other analytics. So that's where the digital transformation comes in. So that's why am I telling you all this? Because if you do not have that level of understanding of what we are going towards, then you're going to always think it's a freaking Zoom call or it's a Google Meet. That's not what we're getting into. We are actually at the precipice of digital transformation of healthcare. And that is why telemedicine is the key thing. Because until the patient interaction goes digital, you cannot have the sharing of data. You cannot have remote patient monitoring. You cannot even have teletherapies. You cannot have all the data that is needed for artificial intelligence, computing, increasing the patient experience, and having the data sharing problem which never existed in the before. So this is a continuum that we have to go. And the starting point, the most important starting point is telemedicine. But if you set it up correctly, right? If you're going to set it up as a Zoom call, you'll never get there. That's the key thing. That's why when we say implementation of virtual care, it is not about implementation of virtual care only. It is literally the first step in digitalization of healthcare itself. So this is the paper that I wrote, and then one of the papers that we have been writing, a slew of papers itself. So what I'm going to do is I'm actually going to switch to this paper. I'm going to tell you what we have written, and then we're going to talk about pitfalls. Actually, why don't I come to this at the end and then go from there. Look, what other problem is in terms of medicine is, unfortunately, the data is very multi-dimensional. What does that mean? So there is variations of data, right? I mean, clearly there's data issues in any industry. What do I mean by that? So for example, if you go into e-commerce industry, you need data of what? Clients. You need data of suppliers. You need data of logistics services. That's all there. But what is the biggest difference in healthcare? The dimensionality is also very important. There's a huge difference of Junaid Kalia at 40 years old and Junaid Kalia at 20 years old. Because my biology has changed. My complete physiology changes as we get older. So not only that we have to take care of all the data that have different streams in any industry that's there, less so, but there is definitely in any industry. But unfortunately, more importantly, we have to take the continuum of a time itself. There's a past, present, and then we have to predict what the future will look like. So unfortunately, the data in healthcare is such a hard problem as compared to any other industry. Not to say that, of course, we have a multitude of variations. We are looking at now disease data, which we normally do, right? Genomics, radiomics, clinomics, microbiomics, all of this data is coming in. But then we are actually generating ourselves with more data, as we know, pulse oximetries on a regular basis, voice data now, camera data, altimetry, physiological data, etc. We are getting all the health data, not just the disease data. Disease is when you actually get sick. Health is when you are generally have health care. And that's where the data is coming in. Of course, claims data is one important thing, because we need to make sure that we're delivering healthcare in a value-based system. And once you have that data, you can actually pinpoint where to increase efficiencies and value in healthcare. And of course, there are other research registries, biobanks, etc. Tons of stuff that we can do healthcare. On top of that, we need all of that from past, present, and future, because there is, of course, dimensionality. And this is where the key thing comes in. When you are bringing that camera data, the voice data, both in the disease data, then you really need artificial intelligence, because there's shitload of data. Literally, you cannot fathom how much data we create. As a matter of fact, now it's different because of Instagram and YouTube, but previously, before these two services, there was an estimation that about 40% of all data that was created on Earth was by healthcare, because there were no those services. We were still getting massive amounts of MRI files and CAT scan files, and genomics was used to be megabytes of data. Of course, now things have changed, because you have gigabytes of YouTube videos, or petabytes to be exact. But clearly, there was a time where healthcare data has been growing for years in the past. So we're seeing that once you actually have this data, you're going to see artificial intelligence enabled. There are three big ways of artificial intelligence. We have digital therapeutics, tokenization, manufacturing, genomics. They're all going to come into play, including the virtual technologies, and we're just seeing the start. Because what we're going to see is going to be more fascinating. What is more fascinating than just doing virtual care? This is the pinnacle. This is where we are trying to go. Now, I'm just giving you a US experience right now. Is US the biggest money loop pit in healthcare system is hospitals. About 50% of all money that is spent on healthcare goes into hospitals. Extremely expensive. Huge problem. And then more importantly, it restricts a lot of people to get care, come to hospitals, etc. It's not easy, right? What the pinnacle of virtual healthcare will be, virtual hospital at home. And this was, what? A hospital at home? And this might actually feel like really odd. Is it really possible? By the way, I have a whole YouTube video explaining some of the data behind it. By the way, in COVID, Medicare, which is, basically sets the rules here in the United States, actually created what we call hospital without walls. There was a whole program where patients can stay at home, and they were allowed to stay at home with a physician, monitoring them with, remote pulse oximetry, so that they can actually get the care while they're at home, because, hospitals were really overwhelmed. But at that point in time, they realized that patients were getting equivalent care or better, because they had decreased hospital admissions. And then the realization goes further that, they have now opened up that we're going to have hospitals at home in the future. I mean, I know it's odd to hear, and I don't know what happens in Lebanon or other countries, but at least in Pakistan, the rich have access to it already. I mean, I as a physician used to go to some rich places, persons, and provided care in their own homes, while the patient at their home had a ventilator, a hospital bed, and a nurse sitting there. Right now, I mean, this is happening as we speak. As a matter of fact, it's been going on for years. So that services can now be democratized because of technology, because a physician doesn't need to literally travel there, but can be virtually beamed in. The nurses can be in and out, and then the nurse, it doesn't have to be a fully licensed nurse all the time. Actually, there could be nurse assistants over there. The rehabilitation services can be there to teach the bedside person, hey, do this to the patient, do that to the patient, and come in and go as we please. As a matter of fact, right now, generally speaking, in Pakistan, at least the lab services are nearly completely getting into virtual space. As I order a physician orders a lab, what happens? A phlebotomist travels to them, collects the blood at home, takes it back, and sends the report over, believe it or not, WhatsApp message, and then that is end-to-end encrypted over there. There's no HIPAA rules, so they actually click the link and then get their result. as we speak. This is true virtualization. So why can't this happen for a patient who's slightly more ill? I mean, there will be, of course, if you need a surgery, you need to go to the hospital. Or if you're really acutely ill, you need to go to the hospital. But eventually, we're going to decrease the burden of physical hospitals and provide significant level of care at home. And your home will be your care site. That is true pinnacle of getting where we are. And this is where people forget, right? Well, I don't see artificial intelligence. That's pure bullshit. Look, I can give you examples after examples. As a matter of fact, I think I wrote an article, Artificial Intelligence in Telestroke, and I actually physically use AI right now to provide stroke care as we speak. There are available applications that automatically detect if there is a bleed in the brain, that automatically detect if there is a large vessel occlusion of M1, and according to that, we actually plan it out, decreases the latency for the patient to get care. What difference does it make? Because stroke is all about time, and therefore, if you can save literally 5 minutes, you can save a whole limb. So therefore, AI makes more sense. But even that, there's so many things that AI can bring to the workflow, but why we are not getting there? Because we are not able to collect the data, aggregate the data, and then provide intelligence. And people say, well, this is all again bullshit, this is all pie in the sky. That's the term I hear. And true, it is pie in the sky right now. Because here's the thing, when there was dirt roads, you cannot have, fascinating, trucks going in and out to deliver foods. Why? Because there was no road. We are literally building the road as we speak. Which gives me to another example, just to give you the difference between digitalization and digitization. One of my friends asked me from Pakistan, hey, why don't I get a Tesla? I said, what the hell are you going to do over there? You do not have lanes. Nobody follows traffic signals. What's the point of getting an autonomous vehicle? Because there's no digitalization in the whole country. Literally, the roads have to be completely properly lined. Everyone is actually following the regulation, and there's a light that people do, and then it makes sense. Do you understand? So that's why digitalization, especially in emerging countries like ours, is extremely important. Coming back to AI as a service. So how AI is going to develop is very simple. We're going to develop right now, as I told you, in a computer vision that just does one thing, just detects bleed in the brain and then goes in and tells you one portion. That's one service. Same thing when we are talking to the patient, there will be another service that takes the video of the patient and tells me if there's a facial droop. There will be another service that's going to be doing speech analysis that's going to do, patient has dysarthria. That is AI as a service, AI as a service, AI as a service. Now, these all AI services are eventually going to continue to improve and then aggregate into a super AI. And that's where we are going to slowly by slowly. That's exactly what happens, how Google developed its technology, because they did YouTube video and audio analysis, YouTube and then, imaging analysis. Do you think they developed it like simply? It took them 20 years to actually come to this point. And what advantage did they have? They had that data. Literally, they have the data. So what we're going to do is basically, I'm going to go over some of the pitfalls and everything, and I'm going to come to that. So this is the paper that we wrote. And one of the things that we wanted to talk about is that, again, same thing, how do you differentiate between the telemedicine? And one of the things that we wanted to talk about is what is really the key portion of things. The design principle when you are implementing virtual care is that you have to talk about patient journey and experience. If you're not going to do that, then the patient, it's going to be not something that there's going to be an adoption. That's the problem that comes in. There will be an adoption problem. Because if you're not going to make it easy for the patient's experience-wise, should be one click, should be easier. There should be big icons. So if there are older patients, they can click. It should be easier for them to get their family members on board within the same care. My mom was actually literally having a in-person visit recently, and then she had to FaceTime me. Again, why the hell was there an in-person visit in the first place? Because to be honest with you, it didn't need to be. And then it could have been one click, got me in, I talked to the doctor, and then go from there. But at the end of the day, again, there will be areas where you need to have that availability issue. Well, FaceTime works. It's not HIPAA compliant. They cannot use whatever I told, technically, legally speaking. So there are issues that are coming up with legal stuff as well. Not that they can actually not use it completely, but at the end of the day, it becomes a problem. More importantly, data is lost. You cannot store that data, right? So therefore, you need to design the whole patient journey and experience. And then more importantly, it's not just about the patient. If I'm going to have an experience as a provider, if it's going to be tough for me to provide care virtually, I'm going to say, what the hell? Don't worry about it. Because it's just not so easy. So it has to be a seamless experience. So therefore, when you're designing a system, you have to make sure that everything is one click and it's easy to implement both from the provider side and the patient side. Again, one of the key issues is that, in my opinion, the core value should be equity, access, and then most importantly, that there should be a continuity of care. Most of the places, especially when you're looking at emerging countries, they just want to find, well, this is the acute care, get on board, move on. True artificial intelligence in digitalization or true virtualization means that you can get to the same primary care physician again and again, same cardiologist again and again. You have the ability to have the whole system in there, and this is a continuum process. Sometimes I need the person to come in so that an EMG nerve conduction study can be done. I need that patient to physically come in. So don't think of it that the virtualization or digitalization or telehealth means that you're not going to have in-person visit. It is one of the ways to actually provide care. So therefore, there will be a proper, clear, area in which both in-person and virtualized care can be provided in tandem, and this is also a tool, so use this tool when you need it. Again, this whole paper goes through this. This is again open access, available for everyone. We looked at the technical challenges and priorities in the virtual care neurologist, where you need to actually make sure that the electronic medical systems are talking to each other. I talked about the UI design. We talked about PACS, which is extremely important for us. And again, hardware requirements, what you need from mics and everything. So when you go through this, and if you're designing and implementing specifically for neurology, because a lot of its stuff was made for neurology, would be actually something that is important. It's already 35 minutes of the talk that I'm gone into, and I want to really go into some of the questions. Before I finish myself, I am looking for Arabic translators because we are developing this whole patient education material in neurology, and this is bringing in basically PDFs like this. So if anyone is interested in helping me translate this into Arabic, please feel free to reach out to me. This is currently in English. We are doing an Urdu translation as well. And then as a matter of fact, one of the things is that I have basically done a whole course. It's called Decide Wisely, and it's a guide for medical students to choose their medical specialty in terms of the future. So we have all these things. If you email this email, manager@aineurocare.com, they will give you a code and you can have this course for free. That's my way of saying thanks for inviting me. And again, if you want to get in touch with me, the best way to do is basically go to LinkedIn. And I'm most of the time available via LinkedIn. And then of course, whatever literally I talked about, practically most of it is on different videos on YouTube. So there's a lot of stuff on the YouTube that I'm doing. So you should be able to get a hold of me over there.